Cancer Conversations, a Harold Leever Regional Cancer Center podcast discussing all things cancer and giving you information to improve yours or a loved one's cancer journey. Hello and welcome to Leever Cancer Conversations from the Harold Leever Regional Cancer Center. Today we're happy to welcome Dr. Vadim Zarbin, a St. Mary's Hospital oncologist with offices at the Harold Leever Regional Cancer Center. Today we'll be discussing chemotherapy and how to manage potential side effects. Hello, Dr. Zarbin, you're very welcome.
Thank you for having me today.
Well, let's start off by talking about chemotherapy. What is it and how does it work?
So chemotherapy, or chemo as we call it, is just the use of medications given usually intravenously and travel throughout your whole body. So it really helps to kill off any sort of micrometastatic disease, little cancer cells that have gone beyond the original site of origin, and getting rid of those cancer cells. We know this by historically having done many trials where giving chemotherapy improves survival as opposed to surgery or surgery with radiation alone.
And if someone needs chemotherapy, how often do they get treatment?
It really depends. The main thing that it depends on is the type of cancer, the stage of the cancer, and that will really drive the types of regimens that the patients receive. The regimens are given in cycles, so sometimes it's given once a week, sometimes it's multiple times a week, and usually in a 2, 3, or 4 week cycle. In between each treatment, there's always a rest period. The rest period is as important as the actual treatment itself, since it helps your body recover in between the treatments.
Great. And we know that there are potential side effects of chemotherapy. Let's talk about them and how to manage them effectively. We'll start with fatigue.
Sure. So fatigue is a very common side effect that patients experience while receiving chemotherapy. They describe it as something as a deep tiredness that frequent rests or napping doesn't help. This can occur either immediately after having received chemotherapy, like the following day, or more commonly about 3 to 4 days after receiving chemotherapy. I usually tell patients to really pace themselves throughout these days and really listen to their body. A lot of times, patients conversely can actually improve their fatigue by doing short walks or adding some light movement during these times.
Okay. So next up is the risk of infections.
Risk of infections is another side effect that we always talk to our patients about. Chemotherapy targets rapidly dividing cells. White blood cells are one of those types of cells. We need our white blood cells to fight off infections. And a lot of times when patients are receiving chemotherapy, their white blood cell count will decrease. They may be at a higher risk for infection. Before each treatment, a patient comes into our office and has their blood checked. White blood cells are one of the things we look at. We need to make sure that their counts are enough for them to receive the next round. If they're not, we either hold the medication, reduce the dose, or we give them another medicine after having their treatment course in order to boost up their white blood cells.
That makes sense. So another possible side effect is bleeding risk. Can you talk about that?
Of course. Bleeding is another side effect that we have to manage while patients are on chemotherapy. Chemotherapy can target rapidly dividing cells such as platelets. Platelets are one of the body's ways of stopping bleeding. And many times when patients are receiving chemotherapy, their platelets can drop precipitously. Fortunately, we check the patient's blood work before each treatment, and we see if their platelets are low, we have to adjust the doses or hold the treatment. But it's also extremely important to let your care team know if you're having any sort of bruising, bleeding gums, or anything unusual so we can address it sooner rather than later.
Great. So let's talk now about nausea and diarrhea and how to handle them if they become a problem.
Sure. Nausea and vomiting were more common years ago than they are now. Thankfully, these days we have many supportive medications to really help offset any sort of nausea and vomiting. These medications are usually given before the treatment is even started. Sometimes we prescribe them to their pharmacy and they start the medication either the day before or the day of the treatment. And we also give them enough to take at home. But again, it's always important to tell us or the nurses or whoever is involved in their care whether those medications are helping or not, since we could add different types of medicines in addition to the ones that they're already on to really help with the nausea. In terms of diarrhea, that's another big issue that we encounter, and it really depends on the type of treatment that the patient is undergoing. And again, very, very important to let your doctor or your care team know if you're having diarrhea. If you are, we need to make sure that your fluid status is good and you're not becoming dehydrated. We can really manage and mitigate these side effects by giving you antidiarrheal medication, making sure that it's not diarrhea related to an infection, and keeping your fluid status normal.
And what are some of the other things that patients ask you about?
Another question that I get from patients is whether chemotherapy will cause them to lose their hair. That is extremely common, unfortunately. And it really depends on the type of chemotherapy you're receiving. So, not all chemotherapy drugs cause you to lose your hair, but unfortunately, many do. I tell patients that it can be emotional since it is a reminder that they're going through their cancer journey. But I also tell them that most of the time it is temporary. Once their treatment is over, their hair usually grows back. Also, at the Leever Center, we help patients with different resources while they have hair loss, whether it's a wig program, head coverings, or connecting them to support groups.
Excellent. And that brings up another question about what other supports can help patients dealing with side effects.
At the Leever Center, we have many resources to help patients through their cancer journey, such as a social worker and a nutritionist. I also tell patients to seek out support groups online, mainly Facebook, where patients can find people who have gone through similar journey that they are going through in order to find support. And a lot of times, many of these patients share a lot of tips and tricks that help them through their cancer journey. And I actually learned a lot through them because they share those tips and tricks that I can tell other patients.
Excellent. And do you want to share those practical tips with us now?
Sure. Some of the practical coping tips that patients share is planning your day around your energy, staying hydrated, eating small, frequent meals. Also, what really helps them is keeping a symptom journal or just journaling in general.
Does diet and exercise have any benefits for helping mitigate side effects of chemotherapy?
That's an excellent question. And yes, both diet and exercise can really help mitigate a lot of the side effects of chemotherapy. There are a multitude of studies that are coming out now where incorporating exercise during the patient's chemotherapy can help reduce fatigue, improve sleep, and even boost their mood during chemotherapy. Nutrition is just as important. And there are many studies that are now incorporating different types of nutritional intervention, whether it's plant-based diets or intermittent fasting, which helps mitigate some of the side effects and inflammatory findings that we see during chemotherapy. Patients experience less side effects and are able to get through their treatments.
Well, that's great information. Thank you for being with us today and sharing your expertise. We look forward to talking with you again soon.
Thank you so much for having me today.
Be sure to check out our website, levercancercenter.org, for more great content and new podcasts. Content produced by Leever Cancer Conversations is for the community and is for education purposes only. We do not diagnose, treat, or offer patient advice. Thanks so much for listening.